Good afternoon. My name is Rachel Leventhal-Weiner, and I'm the Chief Research and Planning Officer with the Office of Early Childhood. We thank you for joining us this afternoon for our virtual town hall. We have live Spanish interpretation available in a simultaneously set up Teams meeting. If you required Spanish interpretation, you should have received an invitation to that meeting. If you did not receive an invitation and still require Spanish interpretation, please let us know by leaving a question or your contact information in the questions pane, and we will respond right away. I want to confirm that our Spanish interpreter today, Edgardo Ponce, is with us. Edgardo, if you just wanted to say hello. And okay, Edgardo is not able to say hello right at this moment, but we thank you for joining. And throughout the broadcast today, if you have a question for the agency, we're able to respond later in the question and answer period. You can leave a question in the questions pane. And with that, I present Commissioner Bai.
Hi, thanks so much, Rachel, for your help setting this up, and Maggie and the whole team. And it's good to be with you all, even if virtually. I'm glad you're here, and we've tried to set up an hour and a half so there would be more time for questions. We may not use it all, which is fine, but we wanted to be sure to have time for some back and forth. I guess I wanted to start today to say I just hung up with the director of a program who called to say how challenging things are right now for her program, that they've had a couple of COVID cases. They're struggling, trying to figure out the finances. Staffing is incredibly hard. And this is one of the most can-do people I know in Connecticut. But I thought I'd start really in honor of her program, but also to say that the saddest part of all we talked about was that one of the grandparents in her program, who was in her mid-50s, just passed away of COVID this week. So on top of all the challenges that they're facing, I think the reality of this pandemic really has hit their program and hit her hard. And like many of you out there dealing with sometimes cases, in the most times not. We haven't had that many cases, but we certainly have seen an uptick, which I'm going to talk about later in the slideshow. But I just thought we'd take a moment of silence in honor of that grandparent who was such a wonderful caretaker to her grandchildren. It's a tremendous loss to that family, and in fact to that child care program, because you do become like family. So for all the struggles and for the people that we've lost to COVID in Connecticut, just thought we'd start with a moment of silence. Okay, thank you for that and indulging me that. Having been a child care director, you really do become so close to your families, and you feel those challenges. And at a time like this, when families are facing so many challenges, they're really leaning extra hard on you at a time when you're facing challenges. So our goal today is to update you about maybe some programs that can help you, about what's happening in the field, what parents are seeing. We've just completed, UConn just completed its analysis of a parent survey in Connecticut. So you can see that. And I have these slides to review. They are not comprehensive. When the team met about what do we need to update folks about, there's so much going on. This is part of it. But as part of today, we're going to have a conversation about listening sessions around the state and updates for school readiness and CDC meetings that will be coming up as well. So let's start with the slides. Deb Flitz is going to assist me. Deb, if you can turn to the next slide. Okay, this is simply a slide which we try to keep front and center about our mission and vision. And one of the reasons I'm sharing it with you today is just to say that we are doing some work at OEC around updating our mission and vision with the committee at the agency around advancing equity and anti-racism, and with input from our parent cabinet. And we will welcome input from you all as well. We think we have a strong mission and vision, but in 2020, we all need to be stopping, assessing everything about our practice and advancing equity and anti-racism. So just to let you know, that's just some internal, non-COVID, but important work going on at OEC. Next slide. Okay, so what we're going to do today is I'm going to give you an update about some data, some information, and the memo updates, some resources and supports that are available, communication, how we can communicate better. I want to plan some listening sessions and get your feedback about how to best do that, and also update you about our licensing and consumer-friendly website. Next. So this is a chart that I get every other week or so from United Way, and I know Rachel in our office is working with OPM to make this kind of information part of the state's data dashboard. The Yukon goes in and analyzes it for us each week, and this has helped us keep the governor and the Unified Command up to date about what's happening with childcare. If I took this back to March, you'd see more of a graph where program openings grew from very low to open. But this is programs that open and closed, where you can see over time how more and more programs have opened compared to closed programs. But we still have significant number of programs closed. And I'm happy to answer questions about this at the end, but I think it sort of explains itself. You can see open providers increasing and closed providers decreasing over time. Next slide. And this can show you where we are compared to our pre-COVID childcare capacity. What you can see is about 3/4 of childcare center capacity. We've regained about 3/4 of that capacity, and just about more than 3/4 of our family childcare capacity for slots. Where we're missing a lot of spaces is in those exempt programs. So public schools, and you might have heard some of that in the news this week, where fewer families with preschoolers and kindergartners are showing up to public schools, but also community-based programs that may be run by the city, that the cities are overwhelmed and they just haven't opened, whether it's an after-school program or a preschool program. We've lost a significant amount of slots there. These are the slots available, and as we know from you in my conversations with you all, just because they're available doesn't mean they're full, and there's a wide range. We have programs in the state that I'm hearing from that are saying, I can't take all my families back, I don't have enough space, 16 or 18 is not enough, it's too hard on my budget. And then I have other programs calling to say, I don't even have half of my families back. So there's a wide range of supply and demand going on in Connecticut, which is really wreaking havoc on our small businesses that are childcare programs. Okay, next, Deb. This slide really shows you the big picture. So the total number of available childcare slots at the end of October was about 87,647, or 64.6%. This was an increase. We really saw flattening, and then October was the first month. We saw a big increase in September, but at the end of September, it totally flattened out. And then the beginning of October, we saw another little increase. So we also had 40 programs open in October. So that's what got us to the 68% open. And the number of family childcare programs opened went up as well, and they're almost at 80%. I thought I'd get questions about what about programs that haven't reopened, because you could see there were some. So what I asked UConn to get with working with United Way is how many programs have dropped their licenses. So we've lost 2 group homes, family group homes, 52 center licenses that they've let lapse 102 family child care homes. At the same time, there were 83 family child care licenses issued in that same period. Now, what we have to do with this is look at what the story was a year ago, because we have been losing capacity, but we're certainly concerned about the loss of childcare infrastructure. It's why we've been working so hard on the federal level to get the funds. And we know from programs who've been able to remain open that doing so is challenging. Some programs are going into their credit lines, and programs really need help. So next. So we asked, I wanted to let you know something else. Go back one more, Deb. We have been in ongoing conversations with both superintendents and local health directors. Last week, we had a call with local health directors. I've been on 3 calls with superintendents, encouraging them that they could operate preschool and that there could actually be toys in the room, and kids could make this work. And it's been working in childcare programs across Connecticut to try to encourage that supply. And also, we had heard stories from programs that local health directors were not being so supportive of the reopening of childcare, or not understanding what childcare looks like. So I'm really grateful that Michelle Levy and Andrea Brunell put together a PowerPoint with pictures of this is what it can look like, because there were suggestions of classrooms that had no supplies, or kids had everything totally separated in plastic bags, and they couldn't get within 6 feet of each other. So we wanted to show what it could look like, and we had sort of these, it looks like this picture. Next one, Deb. So that they could see. And we also told them about the Walter Gilliam study that showed very little spread of COVID in childcare programs. But just to say, kids still need materials, they need to play. A lot of it is just a lack of understanding from local health directors. And also some of the plans that school districts had come up with were really challenging for early childhood teachers who understand how young children learn through play. So we have been out there trying to do some education to folks who maybe don't understand early childhood, and particularly trying to get to the local health director so they could see what early childhood can look like in a pandemic. None of us have seen it before, neither have they, so we're trying to be supportive. And if you have challenges with your local health directors, or if we can help, reach out. We have done that multiple times on behalf of programs. Now, this probably should have gone before the last 2 slides, but I'll come back to this. So we had a lot of questions about what parents were seeing, and we'd seen the national study about parents' ideas about childcare and COVID from the Bipartisan Policy Center. But we had enough questions about, but what about Connecticut? What's going on in Connecticut, that we thought we should go to the field and ask families of preschoolers and infants and toddlers what they were doing about childcare. So we did that. And next slide, Deb. So what you can see here is that parents started to make very different choices during COVID, from before COVID and during COVID. Way fewer were choosing school-based or childcare programs, and more were choosing family childcare, friends and family, and keeping their children at home. This is what's really impacting supply. We have a system in Connecticut that's more than 75% funded purely by parent tuition. We spend a lot of time talking about school readiness and CDC and Care for Kids, and those are great programs, but it's nowhere near half of the system. And so when you have parents who are your consumers, and you see reductions like this in how much childcare they're choosing, and you see increases in how many children at home you're seeing, this is going to have a huge impact on our industry, which is what you're seeing. So this is quite interesting and also challenging, which is why, again, we've been really making the case federally for a child care bailout as part of the stimulus. And it's not a bailout, it's actually, it's really sustaining child care infrastructure. And the smallest was 25 billion, but it hasn't passed, and it didn't pass, and we don't know where that is. So our job now is, given what we know, telling you what we have to help now, and then listening to your questions and having some listening sessions about what we can be doing more. So next slide. And these are the reasons that parents said that they kept their children home. And so that's where the work, like with superintendents and the local health directors, getting the information out about the study by Walter Gilliam is at Yale is really important. And I guess I should have had a slide about that on here. But if you Google Walter Gilliam childcare COVID, you will see the study, and it did get wide national attention. I'm assuming most people on this call know about it because Connecticut participated. 57,000 childcare teachers. They compared those in programs that closed to those in programs that stayed open, and what they found is that teachers in programs that stayed open were no more likely to get COVID-19 than teachers who were in programs that closed and were not working with children. And what sort of the conclusion is that the amount of COVID that you see in childcare is really related to community level spread of the disease more than anything else. And that childcare programs, because of the good practices of the teachers and all the cleaning and hand washing and masks, that has been able to reduce the spread or make them even safer than just being out in the plain old community because of all that. So these are the reasons, and you can see by far is that they were concerned about COVID. Second is that they didn't need care. Now this, with the unemployment rate around 10%, there are more parents at home. There are also parents who are teleworking, who are patching things together and saying, I'm going to save that money because I'm working from home and my kid's homeschooling, and I don't want to run the 2-year-old out or 3-year-old out while I'm home with a 2nd grader. Everything is disrupted right now. So, but I thought this was really helpful to see. This is Connecticut specific data. Okay, Deb, next. And this is just a quote from a family. So we're seeing parents concerned about their child's health and safety, making incredible sacrifices for their children. Okay, next slide. Okay, I'm going to talk you through some of the resources and supports from OEC. What I say every time I talk to you about the supports that we have, we hope they're helpful. We know they are not sufficient. We continue to seek out other funding from the COVID Relief Fund and other sources, and advocating for more federal funds, but also advocating for the state CRF funds. So first thing I wanted to tell you is that over the past 3 weeks, all the memos have been updated and reposted to the website. It wasn't about policy changes. It was just to make sure that all those memos, I think we have like 31, Deb will correct me if I'm wrong, but about that they all are up to date and consider any of the changes that have happened over time. We want to be consistent and clear because things change so much. So those were issued November 3rd. And this was really in response to requests from the field, like, there's so many, I don't know if I have the right version. We just want to make sure everything was right. It also has the most recent guidance around masks and group size. And I've put the link in the PowerPoint. I don't know if it's possible to put this PowerPoint in the chat, then people could just have the whole thing as well. If someone could do that, that would be great. But you can get to our website, www.ctoec.org, and find these memos. Okay, next. So memo 23, speaking of memos, is about testing. I put this up here because all those stars on the Connecticut map are community health centers. And community health centers have free testing. So I just think it's important that you all know that, and you're welcome to go there. Now, they have enhanced testing in communities that are in the red zone. And so if you live in a red zone, it should be even easier to get testing because they're setting up even more sites. But you can call a community health center and get free testing. There are many ways to get testing that are all listed in this memo 23. But I know with our family, we have found 211 to be incredibly helpful as a way to find testing. And at the beginning, when there were limited tests, they weren't encouraging folks to go. But now, if you have a staff member that's concerned about their health or concerned about an exposure, or just concerned about their day-to-day exposure, they have these testing sites all over the state. So I think you'll find them helpful. Okay, next. This is a map from this week in Connecticut. I'm sorry. This is from October 18th to 31st. So up until about now, they're still collecting on the other, on the current dates. But what you can see is that the state has gone from having about 5 communities in the red zone to now having many more. I'm not going to count those, but many, many more. And so I just want to take a moment to remind you, as Governor Lamont wants us all as commissioners to be reminding their constituents and their staff that it's really important to follow like 5 basic steps. That is, stay home if you feel sick, wear a mask, stay 6 feet apart when you can, even if you're wearing a mask, avoid gatherings. This is where most of this is happening. People are tired of being home and they want to see their friends, and they go to gatherings, and that seems to be where most of this is starting in Connecticut. And then this is important too, hold other people accountable. If you are in a setting or you are out in public, the masks and other items like that are so important. So we don't know, I just said before, things keep changing. We don't know what is going to happen next in terms of COVID or the governor's shutdown, et cetera. But we do know that COVID is increasing in communities across Connecticut. And I know I've heard from many of you about increasing group size. I know we're at 16 now for most programs, 18 if you're an after-school program or you have a lot of space. And you have a lot of space, I should say, just to be clear. But with the with the transmission going up like this, we remain concerned about this, and the Reopen Committee remains concerned about it. You might have seen, not that it's the same thing, but restaurants have just had to step back from going to 3/4 to half capacity. We're not going backwards, but I don't anticipate going to 18 during this time of COVID spread. And just for full transparency, DPH is the collector of information, but we have been keeping information over time. I've talked to you about that before. And at most, we were having, the most ever reported in a month was really 22 cases were reported to us. We are not the official reporters, but our licensors are in touch with you. You often call them if you have a problem or what do I do? And so I think we hear about a lot of them. And since it's the same way we've been collecting over time, we were around 9 to 12 a month at the most. It was like, maybe it was 6 the first couple months, and then it was averaging 4 or 5, then it was averaging 9 or 10 a month. But then in July and August, it was like 20 a month. And again, this is out of more than 2,000 programs, so it was small. But last week, we had 30 cases reported to OEC in 1 week. So we know that a lot of you are dealing with shutting down classrooms or shutting down your program. It's incredibly disruptive for you and for families and your staff. And I know I've heard about the staffing challenges going on out there, and then add to that staff needing to quarantine or stay home if they have the sniffles or the slightest cough to be extra safe. This is presenting huge challenges that aren't always so solvable, we know. And some programs are considering closing. That's up to you. But what we do know now that's different from before is we know that a lot of the mitigation strategies have really been working for programs and the spread of COVID. But we do know that you're all dealing in communities that have way more COVID-19 present than were present a month ago. So I just wanted to make sure I spoke with you about this and shared the map, because the governor has the system to try to have extra testing in those communities to try to keep track, and also to guide us as an agency so we know where we need to be reaching out to programs and checking in and being supportive at this time. Next slide. Okay, total change of gears. In terms of resources, we have a number of opportunities. One is the Department of Economic and Community Development has this Connecticut CARES for Small Business grant for nonprofits. There are limitations. You have to have less than 20 employees. And if you have questions during the Q&A, I know Margaret Gustafson is on and can answer them. But really, if you go to the DECD website, it's all really clear there. Those applications are going to be available Monday. I was on the phone with Commissioner Lehman today, and he anticipates that the funds will be exhausted by Friday. So if you run a small business, your child care program is a small business and it meets the guidelines, you can get this $5,000 grant, but you have to do it next week. So I'm giving you the heads up. The other batch of funding that OEC has received is CRF funds to support workforce development. The Governor's Workforce Council came to OEC and said, what can we do to support childcare infrastructure? And we are partnering to help family childcare. I think we had about 160 in process to try to really wrap extra supports around them to help them get licensed quickly, because you saw in the previous slide, families are really looking for family childcare options. So to help them get licensed, and also family childcare with workforce is really helpful because a lot of workforce trainings happen at night. And so we're supporting programs and then working with workforce councils to get them placed. We also are using some of the funds working with the workforce boards to purchase childcare spaces for the months of November and December, both to help the childcare programs, but again, built around the workforce training classes in that region, in that particular field. So whether people in the workforce training come or not, they're sort of contracted spaces so that families can easily access childcare. So that's a way to help the infrastructure. The other thing is we have some small grants that are also funded through the Governor's Workforce Council, CRF dollars. And Deb, that's on the next page because that needs more description than these. So these we are running through the Women's Business Development Council. And here are some details. They're for emergency operating funds. It's almost $1 million, almost 900,000 maybe is a better way to say it. We have 262 programs that have applied, and their details on the website, which you can see there. There'll also be all kinds of supports to help you with your business operations at these really challenging times. They're available in English and Spanish, and there's live bilingual support if you want to check it out and give a call. If you don't qualify, there are certain qualifying conditions. We're trying to save programs that are at risk of closing to maintain that infrastructure, but ones that are likely to be able to stay open at the same time, which is why the business supports are so important. No matter what, there's still a number of supports that you'll receive whether you qualify for the grant or not. Okay, next slide. We also have these operational support grants from Connecticut CARES for Child Care Business. We have sent out Kickstart and supply grants, and then we made the decision, because they were only open to programs that were open last January. We had some funds left, so we extended that to programs that opened between February 1st and September 30th. So I just got an update on how many programs have applied. I want to say it's like 40 programs have applied who have just opened, family child care homes and centers. So we are also going to, when we went to the Office of Policy Management and said we want to send these dollars out to programs as grants and to help with supplies because we have additional supplies. The Kickstart program was really designed for non-state funded programs because we had other ways that we were able to support state funded programs, but the supply subsidies are really meant for all programs, and many of you applied. So we've sent out a little over $6 million in grants to programs, and we have 2 to 3 million more to send out in this round. So what we're going to do is, for people that applied, we would have had larger grants the first round if we knew there was going to be funds left. Because there are funds left, we just want to send those out. So the plan is really not to go through a whole application process again. If you were approved, you're approved, and I think you'll just have to have assurances, but you won't have to go through. There was something like 11 steps back and forth between provider, United Way, Office of the State Comptroller, Office of Early Childhood. United Way touched everyone twice, OEC touched everyone 3 times. It was an incredibly arduous process. This will not be like that. Now that programs are set up, we can get these funds out quickly, and we're doing the analysis now, and next week we will announce what proportion. So, for example, it might be 40% of the original Kickstart grant plus the full supply. We know everyone will get the full supply subsidy. Because that went to everyone, we want to repeat that at the same level of the last time. So that will be coming out without all the application and the back and forth. There'll just be one simple step to accept it. Because what we did find is there were a number of programs that didn't apply because they were worried about the implication for taxes. And we want to give programs the opportunity to say, no, I don't want it, or I don't know if I'm going to make it, so I don't want to give those assurances, but we'll walk you through that. The other thing we have set up are, that number 3 should really just be a bullet. I'm just taking that number 3 back. The WBDC business supports that I just talked about. We are also going to be paying background check fees like we did last year as a way to help as programs struggle financially at this time. We also have training subsidies, scholarship funds, and PD, and AQIS supports and PD. So I don't see accreditation supports on here, but we're working on helping people with their accreditation fees as well, family child care and NAYC accreditation. Okay, next slide. Another sort of new item, but we've been talking about it a while, but it's now ready to go, are these online forms and digital fingerprinting where, we're working on so you can pay with your credit card, you can do your fingerprints digitally, and you can complete the forms online. It's good for you, it's good for us. It's a lot of processing that goes on with fingerprints. And I have Eileen McMurray from our office who's been working on this, who can answer questions about this for you. This is a cut off from the flyer that's going out to programs about this. Fewer errors, faster processing, and we'll be paying the fees through the end of December. Okay, next slide. The other form of funding, and I want to give a shout out to Voices for Children, because it was Emily Byrne who alerted me to this, and I spoke to Governor Lamont, and he did consider the early childhood request for GEER funding. This is where do not ever hesitate to call or reach out to us if you have an idea. So the governor, all governors got some emergency education relief funds, and they're funds to help with education. And so the Office of Early Childhood received $4 million. And what we're doing is we've done some surveys, reaching out to offer resources to families who are at risk, who can't send their children or young children to childcare, and they have limited access to remote learning and technology. So you can see the specific families that we'll be reaching out to. I'm so grateful to the RESC Alliance for their support here, and to New England Assistive Technology, and hopefully soon to CERC, who's helping, because this is a huge undertaking. And Lorna Thomas Farquharson at our office has been leading this charge. You'll be hearing more about this from the RESC Alliance, and we can answer questions on the call as well. But they're just families that are totally disconnected, and we are buying about 4,000 iPads that are fully connected. We've heard stories from family childcare. I was on the family childcare call, and just hearing the stories of all the challenges you're facing, staying connected and helping children. This will help at least those children be connected to what they need. So next slide. So I just said we're partnering with these agencies that are going to help us distribute them, have an application form, provide technical support and learning for children and families. It's pretty ironic that I'm on a computer talking to you about computers with early childhood, because I believe they should be outside every minute they can be, and playing with real materials and playing with other kids. But these are not normal times. And we have a lot of families out there that are totally isolated. You know so much about child development. You've been supporting parents your whole careers. That's what we do in early childhood. And so we have to pay attention and make changes right now so that we can make sure those families who we're not reaching, that we can reach. I'm really grateful to Governor Lamont for assigning some of this to OEC. I think it's also going to be used with birth to 3 and home visiting families who have also had technology and connection challenges. Okay, next slide. So this program will be up and running. I think we've bought 11 months worth of connectivity on every iPad, and the iPads will be with the programs that'll be recycling and using them with families. You may have some families who are in care now and coming to the center, but then something happens and they can't come for 2 weeks and you want to stay connected. The rest are really going to work with you. I think we'll get a sense of how this is going. I also think it's important to know that we've contracted with the Erickson Institute as a part of this to provide you with the professional development you need, because we're not entirely up to speed on how to support you with this. The RESC Alliance is going to be tremendous with coaching and support, but both the RESC Alliance and OEC recognize that we needed some TA as well. So Erickson, we're one of the first states they're going to be working with to support you with this. And that'll be available to everyone, because maybe a lot of your families have access to the technology, but you're trying to figure out, how do I reach them? How do I stay in touch with these families? And frankly, we don't know what's happening next with the virus, and if more kids will be remote. So we want to get these out there. So we're working on it. It's a big undertaking, but I'm grateful for the team that's working on it. Okay, next. Here's an interactive part. I want you to use your chat function here. Something that I've heard from directors and in talking to teachers is that it would be great if we had something besides webinar where we can have conversations with each other, where we can have more interaction with you as commissioner versus just Q&A. And so we want to set up several smaller group listening sessions. And if we need more than several, we will do that. So I'm just going to stop talking, and I'm sure you'll all say, thank goodness. I'm going to stop talking for about 3 minutes, and have you type in the chat, if you think about listening session, what time of day works? What are some of the conversations? Oh, it looks like at the bottom, I was saying some topics people have asked about. That was going to say something on the bottom there. So ignore the last sentence. So just type in what topics. Would you just want some open-ended conversation? What do you think is the best group size? So we have time to listen to each other and back and forth. And also, I just think it's important to know, and I may have dates for you. I'm going to ask my team while you're writing what the dates are, but we also in the next couple meetings are going to have smaller, well, they're not all small, but meetings with the school readiness liaisons. And then after that, we're going to talk to them about structuring conversations with school readiness programs. And then we are going to have a conversation with Child Development Center programs in the next couple of weeks for that give and take. So just so those programs know, those are coming up soon. But on the first three, I'm going to really stop talking now. Type in what you think would work for listening sessions for OEC.
Commissioner, I've added a poll for folks to respond to in terms of the best time of day. The topics are a little more difficult to add in a poll. So folks look in the poll section. I believe that there's a, on the right-hand side, I have added a best time of day. I'm not sure if it's going to, okay, there we go. I've launched it and it's distributing. So folks can offer us back time of day. We understand, I see some folks are saying that lunchtime might also be a good time. The topics are extremely helpful and we'll take that back to the team to code those up and really figure out what the best topics will be to pursue.
Thank you.
I'll close the poll, but the questions pane remains open for everyone to offer up suggestions around topics and ideas. And when we're ready, we can shift to question and answer.
Okay, thank you for that feedback and feel free to keep putting messages in the chat function as we go through the Q&A session. Another announcement I just wanted to make is that we have launched what the feds refer to as a consumer-friendly website. This is a website where families can go and see the last inspection reports over the last 5 years. This is part of our CCDF requirement, and Deb Johnson has worked so hard to get this up. We did not do a big announcement at this time because we wanted to do a soft launch and get feedback. So if you go to 211 Childcare and you search your program, or you can go to a zip code, you'll see that now the programs show up, and then also so do the latest inspection reports. I know our licensing team has been working on this for a long time, knowing that these reports were going to be public. And so we will continue to work on that, and we are open to your feedback on that. And you know, listening sessions could be a good chance, but I've seen a number of emails come in from you all making some really good suggestions. So next step, this is just an overview of the programs that we oversee at the OEC. We don't need to, we can go to the next one, which I think is going to say thank you. I wanted to close with a quote. Mary Oliver, anyone who knows me, many of you don't, but if you did, you would know that I just love Mary Oliver. And she has this quote that says, "To pay attention, this is our endless and proper work, to pay attention." So now is time to pay attention to you, just like you pay attention to your families and your teachers pay attention to the kids. That those are the best teachers, and it's time to pay attention to you and try to be as responsive as we can be, given the resources at hand. But I think we certainly can be doing better, and want to use this question and answer session to answer your questions. And also feel free to provide feedback in the chat that you might not want to share with everyone. But for now, what usually happens here is Rachel answers the questions, but I have a whole team behind me today of folks who are going to answer based on the topic. So Rachel, we're ready to open it up.
Thank you, Commissioner. So we have lots of different kinds of questions, some about the current state and some about future state. So one question that came up, which I'm sure is on other folks' minds, is has there been any further discussion about adjusting the class size? And as we know, this is a major struggle for enrollment. So is there any, I believe you mentioned earlier that there hasn't been any movement there, but I just wanted to reiterate that.
Right. We revisit this pretty much every other week, talking with the Reopen Committee and the Commissioner of Public Health. I'll have a conversation. It's usually Friday, so it's usually 2 o'clock Friday, so I'm missing that meeting. I will call her again. I think the challenge is we've gone back to phase 2, and some of the hesitancy around increasing class sizes is you can't just bump families out if you go up and then go back down again. So that's some of the worry, but really the biggest worry is being indoors in a confined space with children. So at this time, it has not increased. The step to increase to 18 was a first step, but that's only if there's enough space. So we will continue to consider that, and I will reach out to Commissioner Gifford today, since I'm missing the 2 o'clock meeting where we talk about these things. We also are in regular contact with Department of Public Health, and you heard me talk about how much COVID has increased in programs. So things have been going pretty well in Connecticut at 10, 14, 16. There are just some concerns about going to 18 and what that could mean for spread. But I do think the Gilliam study, we asked that week after that came out about the 18, and the decision was not to go to 18 at that point, but I'm happy to ask again.
Great, thanks for that response. We do have a few questions about summer camp and summer 2021, but I don't think we'll be able to address those today. So I just wanted to say that at the start that we see your questions are very attuned to them, but won't be able to provide answers to those right now. So let's talk a little bit about safety in the current moment. We did have a question from a provider around the children over 3 wearing masks, and some concern around that, they have tried and they have shared their frustrations with other providers. They are just concerned around if they have their licensing inspection and the licensor sees children over 3 without a mask, how should they work collaboratively with their licensing specialist?
Sure. I can ask Deb Johnson to take that. I'm happy to take it, Deb, but do you want to start and I'll go after you?
Sure. Thanks, Beth. It's important that programs know that if we go out and we see that a child over 3 is not wearing a mask, our first reaction is not to cite the program. if a child is non-compliant with mask wearing, that is not going to result in a violation against the program. What we will be looking at is how the staff react and how are the staff working with that child to try to bring about compliance. And as long as those actions are being taken, the program will not be cited. We recognize that there will be children that are more difficult in adapting. And so as long as the program continues to work with the child or children, that's fine.
Thank you, Deb. Hopefully that answers that question.
That does. And we do have some more questions coming in response to my statement about not being able to provide guidance about summer care in this moment. Several from family providers around size, as well as camp operators with questions about models. So I just want to reiterate that we will address those questions soon or in the future, but we aren't able to address them today.
Well, do you know what, Rachel? I think I know what they're referring to, and you wouldn't know this. Deb Johnson and I know this, but you wouldn't know this, which is that for family childcare homes and for camps, they have been able to maintain operations as if it was summer. So under their camp license and with the regulatory rules of summer care for family childcare. So I think what they're saying is now on November 9th, if the executive order of the governor is not extended, then their ability to provide childcare for school-aged, up to 3 school-aged children during the day in towns where schools may be closed, that they'll have a problem. So for those of you asking related to the executive order, we have pretty clear direction from the governor's office that the executive orders will be extended. And when they're extended, I can tell you our office will extend with our powers that we'll have under that the summer rules related to family childcare licensing and related to camps remaining open and operating using their summer camp license. So I think that's what that was about. Deb Johnson, do you have anything to add to that?
Yeah, I think some of the questions I've seen, it wasn't exactly clear what they were asking. I imagine that you are correct in that that is the overriding question. We recognize that programs planning ahead want to know in advance, and unfortunately, we haven't been able to give that information in advance. I think we can anticipate Monday being the 9th that we will hear something at that time, and hopefully that's confirmation that it will be extended.
Yeah, and shout out to our legal department because they have been working with the Office of the Governor. When we hear from programs how important this is, they reach out, they say we've got to give guidance to programs. But frankly, what happens is it's a political question. The legislature has to sort of agree, and it always goes up to the deadline, which is not helpful to you or families. But we're clear at OEC that we're giving you guidance that you will be able to continue under that under executive orders. If that changes, we will alert you. But nobody needs to stop providing that care now. I think you can anticipate that it will. I just anticipate that it will continue and carry on because the families really need you, as you know. So.
Great, thank you. We have some questions about the testing that you alluded to or discussed in the presentation, whether the test sites will be offering rapid test results and whether there's been any discussion to include childcare sites as part of some of the mobile testing efforts that are going on with schools.
Thank you for that question. I'm going to start and then I'll ask Deb Fliss to follow up. OEC is in conversations with DPH on this, but related to the school testing, we are not involved in that particular initiative, but we are in touch with DPH around testing. And they have worked hard with the statewide incident command team to make testing easily accessible to early childhood staff. Now, Memo 13, I think if I'm remembering right, has more details, and I'm just going to ask Deb Fliss to chime in on the testing if you have anything to add.
I think it's Memo 23 on testing.
Oh, Memo 23, yeah, okay.
And I think that because you said it earlier, not because I remember it per se. And that the link to 211 is the best resource for people. And I saw some other questions about what type of tests are available where. And generally at the 211 site, you can get that kind of information about whether they offer rapid testing or if it's the other generally 2 or 3 day result return type of testing.
And you can also filter the 211 website by rapid testing. But I will say that the PCR test, which takes a couple of days to come back, is considered more effective, and particularly with asymptomatic people. So I think if you're able to, DPH is recommending the PCR test.
Great. So we have a few questions regarding what happens if someone tests positive. So there's some questions and perhaps confusion around quarantining, whether it's 10 days, 14 days, if there's any official guidance from the public schools. And typically we've said programs should follow the guidance provided by their local health department. I don't know if you want to speak to that, Commissioner, in some of the conversations we're having internally.
Yes, and this is an evolving situation at OEC, and I'll probably ask Deb Fliss. Deb is our incident command leader at OEC. But let me say this, is that our guidance has been call local health, follow their direction, call DPH, ask for their direction, and listing those phone numbers, which I'll ask one of my team to please put in the chat because it never hurts to put the number there. But we were on a national training call this week and saw some states that had really good guidance for programs. And so just this morning, I know I was in touch with DPH because everything we do is in coordination with them about developing a guide in the very near future, and basically relying on the work that other states have done for this. But I'll ask Deb to chime in on this because our thinking, our guidance is we're not public health experts, we're education experts, go to DPH. But there have been enough cases now, and talking to the other states, we're like, well, we can offer more than that. And so I'll just ask Deb to comment on that.
Sure. I think what we're trying to figure out is the intersection between our responsibility around children and staff and the public health role around the pandemic, and that public health officials are the folks with the authority at the local level. And so we're talking about how we can help the local public health folks have a better window into what's happening in early childhood programs and what information is already out there that can help them make good decisions that will support health and safety at the same time that can support programs continuing to be able to operate where that is appropriate. Public health officials are making decisions not only based on individual programs, but also on what's happening in their community. Flashback to the map that was part of the PowerPoint earlier. And so they have a lot of factors to continue. And I think our effort around this will be to help them sort out all the pieces that are relevant in their decision making as they look at what's happening in childcare programs in their communities.
Yeah, thank you, Deb. And just know that we while they're lead, we know that part of our job is interpreting for you all, and having talked to any number of you when there are cases, it can be hard to figure it out. So we are working closely with DPH on this. Our guidance right now is really call local health and follow their guidance. And as you heard before, we're doing our best. We were on with every local health director last Friday on a phone call. We're now attending those meetings pretty regularly, but last week we presented and are trying to bring them information around early childhood ed. And so, especially if you've seen things you think they need to be updated about, you can let us know, and we also will bring them to those calls. The hard part is local health is in charge, and every local health department is so different. It's definitely happened that a program's had a challenge with local health, and we've been able to, in terms of them just not understanding early childhood or not understanding that they've been cohorting, and then we bring in DPH who will work with that local health director and work through it. So we try to help when we can.
Thank you. I'm going to be posting a link in our chat to some of the best places to find testing in the event that folks are of interest, have that of interest. There are several questions around the cases that you reported that have been reported to the agency. Folks are interested in whether the cases were in children or adults, whether they were in centers or family homes. And so I think it would be important to speak to that again.
Yes, I don't have that document in front of me. It was definitely a mix of type of program, some children, some adults. In every month of the data that we look at, it's way more adults than children. But I'll ask Deb, or either Deb Johnson or Deb Fliss. We can start with Deb Johnson if you have any more context to add. And yes, we can certainly make it available, so you make the data available. Yeah, go ahead, Deb.
Since March, there's been now 202 positive COVID cases reported to us in childcare or youth camp programs. They've included, as you said, a mixture of the staff and the children, and a mixture of camps and centers and family homes. But it's important to remember that programs aren't required to report to us, so we know there's been more than that. They are required to report to their local health department and DPH. I just put that information in the chat of who and how to call those two contacts.
That's been the hard part for us, is the required report is to DPH. And people call us for help, and we just thought, well, we have to, since we didn't have great data, we have to keep track of what we have. And also with DPH, now they are tracking it now, and their numbers are way lower than ours. So we're working this out with them so that we have better data. It's just important because we are making decisions about things like class size, et cetera. It's still relatively, compared to having thousands of programs open, it's not that many cases, but they're real, and people get sick, and our job is to try to stop transmission in childcare programs. And it's happened, but it's not that frequent, but any case is too many, and it's so stressful for programs. I speak to programs often who are going through this, and it's stressful on the families, it's stressful on the teachers, and so all those safety protocols are so important that are going on in your programs. But you can't help it if your teacher comes to work and turns out a couple days later that they had a COVID exposure, and then it throws your whole program planning into question. And you've got to get guidance from local health, and you've got to communicate with families and communicate clearly. But we understand that it's incredibly stressful. So I know our childcare licensing staff have been working to be supportive and connect you with health as needed.
Thank you, Commissioner. So we have a number of questions about some of the financial supports, both through CTCARES as well as through the Women's Business Development Council. So I wanted to just reiterate some of the questions around Kickstart funding, folks who are waiting on Kickstart funding or who have questions about that. So the first is that some have indicated that their funding is delayed. You did mention the multiple steps that go through to establish our childcare providers as vendors. So I just wanted to remind folks about that piece of your presentation earlier.
But Rachel, do we have a, let's take these one at a time. I think we're like 99% done with Kickstart funding, except for the new programs. Is that correct? Or I don't know if Margaret's on and can update me on that, but I know we're very close to being ready to close that out.
I am on, Beth.
Hi, Margaret.
So we are in the process right now of closing out the first phase, and that means for all of the programs that were open prior to January 31st, 2020, their expense kickstart and supply subsidy awards are being processed. We are still waiting for some programs to have all the information come back through the comptroller's office and to get those payments out. So we are aware of the delays and trying to work really, really hard to keep folks informed. We know that a lot of programs are reaching out to 211 Childcare to check on that status. I do want everybody to know that we keep an escalations list with 211 Childcare so that as providers contact them, they record all of the information, and if they can't identify the resolution for it, it comes back to the OEC and we work off of that list. So we know that there are some lag times between the payment files and different things going back and forth. We appreciate all of the patience. We know it's taken a long time, but we do take that escalations list very seriously and we're working off of that. The new programs that were addressed this past week are those that opened February 1st, 2020 through September 30th, 2020. And those were all notified specifically through the OEC, and 211 Childcare is reaching out to each one independently to make sure that they go through a process as well. Once we get those folks all cleared out, we're in good shape to be able to look at phase 2 payments.
And Margaret, can you speak to those phase 2 payments? There are some questions around those.
Yeah, absolutely. So phase 2, what we're looking at is for any licensed family home, group home, or center that was paid in phase 1 that is still open, so has not permanently closed. All right, I want to make sure that that's really clear, that we know that sometimes there are these rolling closures because of cases and cleaning and quarantining. So please hear me when I say that as long as your program has not permanently closed, that program is eligible for the next round of payments. We'll be looking at how much of the expense kickstart money we have, as Commissioner Bai indicated, and the full amount of the supply subsidy. So we'll be processing those within, or ready to go through that process within a couple of weeks. As I said, we have to clear out the newly licensed programs first.
And Margaret, while you're still with us, could you speak to some of the Women's Business Development Council consultation services? We have some questions around whether programs qualify for financial support besides unemployment, whether they would qualify, for instance, for some of the Department of Economic and Community Development opportunities that were mentioned earlier as well. And I believe there's an individual consultation you could probably speak to, some of the ways they can provide some support.
Absolutely. Thanks for asking that, Rachel. We're actually so excited to have them as our partner because there are so many opportunities and every opportunity has different requirements and eligibility. It's really hard to make sense of all of those things. And so we do want programs to take advantage of contacting WBDC at any time. And Commissioner Bai just put information up to get to the page about the emergency grants. You can go to the ctwbdc.org childcare page and email them any question. They will be more than happy to walk you through specifics about your program, your type of business, and what you may be eligible for. So please don't feel overwhelmed by yourself. Go to them. They can help you to tease it apart and tell you which opportunities you might be eligible for. They also are providing a lot of technical assistance around developing the documents that you need to apply for these opportunities. So don't think because that you don't have something already in place. You know, maybe you have a shoebox full of receipts and bank statements. they will help you to convert those into the business documents that you need to make formal applications for funding. If you are already a well-established business, they can also help you to think about marketing support, help you to think about emergency funds. So please don't hesitate to contact them. They are very willing to help. No program should be leaving empty-handed. We have opportunities set up with them, not just through the grants now, but incentives that are coming along. So we want you to connect with them.
And as we've just been discussing the expense Kickstart and supply subsidy grants, we've received several questions around whether these are, if you already applied and were approved, were these automatically lumped into the second round, or is there another kind of process? And I apologize if I wasn't clear earlier.
Well,
oh no, that's fine.
I'll give it a try, and you can correct me. You will pretty much automatically receive the payment, but you do have to say you want it. You have to, there will be a yes, I want this. Margaret, was that how you would characterize it?
Right, there'll be a notification with a link to a form, and you will have to formally opt in. So we want to make sure that we hear from everybody, and that's one way for us to be able to make sure that if you're opting in, we know that you're in, and if you're opting out, we know that you're opting out, and perhaps you'll give us some reasons why, but that will help us to be able to process those payments.
Then we did get
I just want to give you a stat out there related to this. We had our fiscal office update our staff about what they've been doing. And our fiscal staff are same number of staff are processing 10 times more payments than they did a year ago at this time. 10 times more payments a month, and have been throughout COVID. So it's such a challenge, but I'm so grateful for them. And I know the wait has sometimes been too long. It's not usual for a state agency to be sending dollars out directly to programs. It's usually through an intermediary. And we have been talking with the feds about helping states if there's a next round of stimulus with some kind of provider who could help get funds out more quickly. Just so you know, I mean, it's a slog in an agency with all the approvals that are required for good reason. It's taxpayer dollars, and there need to be a whole lot of approvals. But we don't get 10 times more staff to send out 10 times, to process 10 times more checks. And certainly our job is hard, but I think the job of you out there running programs right now and dealing with some of the challenges you're dealing is even harder. But I did want to point out that it is a lot to get them out. The second round will be much faster. Instead of 11 steps, there are 2 steps. So it should be about 80% faster. Okay, Rachel.
We did receive a question about whether non-licensed programs are able to receive any grant funding. I believe that Margaret indicated that non-licensed childcare businesses should look into the Department of Economic and Community Development grant and perhaps also contact the Women's Business Development Council.
Yes, that's accurate.
Moving on to talk about supports for the workforce, because we did note scholarships, accreditation support for accreditation quality improvement, fees for background checks, and there's a question about whether these things are only available to programs that work with the Women's Business Development Council, or whether those things are available to all programs.
I'll let Margaret answer, but go ahead, Margaret.
So I think on this slide, Commissioner Bai referred to this before, the number 3 that's in front of WBDC right there, and all the bullets underneath, those bullets are not actually related to WBDC. So that's just a typo in our PowerPoint. So for all of those different opportunities, there is information on the OEC website for each of them. I will tell you that the training subsidy for first aid, CPR, med admin, and anaphylactic emergency medication certification that expired from March 1st on. We are working with 211 Childcare to be able to get those pushed out. Later today, they'll have a list of providers who were in the registry with confirmed employment and had those certifications in place. They'll be reaching out to those providers to help them set things up for the recertification if they haven't already done that on their own. So that piece is coming. You won't find that on the website yet because that is hot off the press. And then as far as the other things, Rachel, I think you asked about some of the other ones. You do not need to be working with WBDC to take advantage of the background checks, the scholarship funds, the PD that's available through your registry account, or the AQIS support, which is our accreditation quality improvement support project. You also don't need to be working with WBDC to take advantage of the staffed family childcare networks. So there are a lot of supports out there to meet you where you are. But we hope that we can connect a lot of them together to really help programs and providers to move forward.
I'm glad you said staff family childcare networks. When I started, I said I can't go over everything that's going on, but a big shout out to our staff family childcare networks. We've gone from 5 to 12. We have tremendous support out there for family childcare homes through 4CT and through some of our federal opportunities. And we can talk more about that later, but I just wanted y'all to know that we're really grateful to the Family Resource Centers and all of our staff family childcare networks for all they're doing to support childcare infrastructure in Connecticut.
All right, there was a question, a clarification around the grants. I think there's been a little confusion on whether these are for state-funded programs or non-state funded programs. The expense Kickstart and supply subsidy are for all programs.
No. So here's how that works. It's confusing. The Kickstart grants, the only way we have to support, private programs, which is like 3/4 of our system. And it's about 1/8 of what we were able to support our state-funded programs with. So we wanted to have some of our funding, and that's what this is focused on, just for the private programs that get less than 50% of their funds from state-funded sources. But the Kickstart's just available to programs that have less than 50% of their funding from state sources. But the supply subsidies are for all programs, and those are going to be funded fully for all programs. Additionally, for those of you in private programs, we are doing, or those of you in public programs, we are working to enhance funding so it's not based on individual children, to increase the amount of funding that comes to programs. And we are giving a 25% operational enhancement for programs that are struggling with enrollment and don't get their full allocation, but they do get a 25% operating support subsidy of 25% of their state grant, understanding that. So we have state funds that we can apply there, and this one bucket of federal funds we're using for private programs, but then this bucket of federal funds for supply subsidies are for everyone, every program, and as are the grant for through WBDC. That $1 million is open to everyone, or 875 is open to everyone. And the workforce childcare slots have been in all different kinds of settings. So we're doing our best to try to use the funds in a way that's equitable across programs, but we do have way more tools in our toolkit for the state-funded programs because of the state appropriation.
Thank you for that. And for folks who have registered questions around very specific types of programs that you operate or very specific questions around eligibility, please know that we take all of the questions that we receive during these webinars and we produce a frequently asked questions document, which we will post on our website. If you feel as though that document does not answer your questions, we do encourage you to reach out to the agency directly to get that answer. And I think we have just sort of one more summative question. On a previous webinar, we did talk about the possibility of child-sized masks. So I don't know if it's possible, Commissioner, to speak to the availability of PPE and other supplies, whether now or in the near future.
Yeah. Well, this is part of why we wanted to fund the supply subsidy fully, is that we understand that programs have extra supply costs. Deb Fliss, I know we did have some child masks go out. You can probably summarize what that was. They went very quickly, but do you mind
Sure.
giving an update on that?
Sure. So we did about 7 months of supply distribution at locations around the state. I know people are well aware of that. Those locations have closed. We no longer have the sources to sustain that any longer. There are some small supply of child and adult cloth masks remaining. We will get those into our office and then we will find a way to get them back out to providers, in all likelihood through licensing visits and other ways that our staff can get them in communities. It's not an enormous supply of either one of those items though. And that's why the supply subsidy is so very important, because it gives people the funding that they need to make those purchases. There are a couple of other sources though that people might find helpful. The first is that the Department of Administrative Services does have a list of vetted vendors on their website, and I'll try to get that link into the chat box. And these are vendors who have committed to providing supplies, and many of them have committed to a certain price point so that you know that you are not paying an inflated price for the supplies. Secondly, through a contract that we have with Connecticut AEYC, they have launched the CTCARES website, which is a shared resources site, and there are also vendors available through that site where supplies can be purchased, and that will help. Those also are vendors who've agreed to discounted prices, and that will help providers stretch their funding.
Thank you, Deb.
So I think we've reached the end of the questions that we have for now that we're able to answer in this forum. And as I said, we will be sure to reach it back out on our website. We will post a recording of the webinar as well that will be linked from our website to our YouTube channel. And Commissioner Bai, I invite you to close.
Yeah, I'm happy to close. The other thing I think we should do is, and I'll say this to you, Rachel, is we should have UConn update that report on the cases because it changed so much through October and November that we want to be fully transparent. So we will also publish a summary of the data that we have. I know we're always worried to put it out because it's not official data. It's self-reported. It doesn't represent, but we felt like that's why we did the report from UConn in the summer. And now, as I said, instead of 20 cases a month, we're seeing 30 a week over the past, certainly over this week was a big increase. And October saw big increases of cases reported. So we want to be transparent about that. And so we'll ask UConn to put that data together. So we share that with providers. Okay, Rachel, does that make sense?
That makes sense. And I just also want to reiterate, we had a question about Department of Public Health and their posting of data, State Department of Ed and their data. We are working actively with the state's chief data officer to make sure our open and closure data is reported so providers can see the state of the sector as well. So I will work with UConn to make sure that that information is made available. Thanks, Commissioner.
Yeah, and you know, as we're talking about UConn, if you found the data helpful today, from UConn that I talked about, that I put up, open and closure data. If that's something that you would like us to share sort of regularly on our website, we can work on that as well. You can comment in the chat I want the data we have if it helps you to help you. And we'll have a full report of the parent survey coming out. Those were slides that were prepared quickly for today as UConn finishes the final analysis. All the data is done. It's just that they're really cautious about how they say things because they are such a strong research-based institution. So we will be sharing that as well. I guess I mostly wanted to close to thank you for all that you're doing for children and families in Connecticut. I'm so grateful for your partnership, and we want to do better. We want to support you more, and hopefully you found this helpful today, some of the information, and we will follow up on the FAQs. We'll follow up with a updated report from UConn on the data. We are working actively with DPH on making the data reported to them something that we can make transparent, much like the SDE data, though it's just so different. Public schools, it's a public system, so it's a very different thing in terms of gathering information from public systems versus information from a field that is so diverse as ours. It's a mostly private system. It's mostly small private businesses. So it's more complex, but that doesn't mean we're not going to keep trying. And we think the information's important for you to share with your staff and your families. So thank you for being here today. I hope you all have a great weekend. We might know who's going to be president by Monday. I know it's been a stressful week with that on top of a pandemic. I think both sides wondering who's going to win because it's so tight. But I think that we're doing such important work nurturing the children and families in Connecticut, and they need us more than ever. We need you as leaders more than ever, but we know that you're facing real challenges and want to be helpful. So have a great weekend. Hope you get outside for a walk. It's going to be gorgeous. This is why we live in New England, people. So have fun. Bye-bye.
Thank you.